So let's continue on with part 2 of the hygiene lecture. And we're going to start by talking about assessment of our patients, and we'll just kind of go through physical assessment, head to toe, things to be looking for when we are performing hygiene care. Let's start with the eyes. We first need to get a little bit of a history on the patient, see if they have any disorders or any conditions to be aware of with the eyes. Do they have any chronic abnormal discharge or tearing with the eyes? Do they use any visual aids, glasses or contacts? Do they have any eye conditions where they have glaucoma, macular degeneration, cataracts? Maybe they have an artificial eye in place. And are they being treated for any eye injuries or have had any previous eye injuries, any surgeries of the eye? And then do they take any ocular medications, and when was their last eye exam? When we talk about normal eye characteristics, what we're looking for are both eyes are centered on the face. The sclera, which is the white part of the eye, is nice and clear, doesn't look like there's any trauma, abrasions, any abnormal coloring to the sclera. There's no redness, edema, lesions, any abnormal drainage coming from the eyes. The eyelashes are turned outward. The pupils are nice and equal, they're round, they're reactive to light, and they do accommodate, and they move symmetrically. Whenever you are washing the eyes, you want to wash them with a warm, moist cloth, and we go from what we call inner canthus to outer canthus. That means the inner corner of the eye is the inner canthus. You start there, and you're going to take that washcloth and you're going to swipe out to the outer corner of the eye, the outer canthus. We typically do not use any soaps around the eyes because that can be irritating, can sting and burn, unless the patient has a certain kind of face wash or eye makeup remover, things like that they want you to use. Otherwise, we usually just use warm water. For an unconscious patient, things that we might need to consider. We really do not want the eye and the mucous membranes around the eyes to dry out. So maybe artificial tears, a lubricant that we can apply into the eyes that might be appropriate and very beneficial. So that's something to maybe discuss with the physician. Maybe they need a light patch applied to the eyes until they are able to have that normal blinking and eye movement when they get to a conscious state. And then we need to find out when their last eye exam was, just to maintain their healthy vision. Moving on to oral hygiene. Assessment-wise, find out, do they have any past history of abnormal disorders or conditions with the oral mucosa? Do they use any orthodontic devices like bridges or dentures? What dental products do they use? How often are they brushing, and do they have good dental hygiene? Are they physically able to do these things? Do they have the coordination needed to do that, or the cognitive function? That confused patient might not understand, might not realize the importance of maintaining that oral hygiene. So do they have that cognitive ability? Is there a chronic illness or even acute illness that is altering their ability to perform this kind of hygiene care? And then any therapeutic restrictions, mobility restrictions that might be impairing that as well. A few pictures here of some abnormal things that we can see with dental hygiene. So dental caries here, some pretty significant signs of that with the erosion of the teeth and the gums, plaque and tartar buildup. This occurs whenever bacteria, saliva, and cells within the mouth build up and start to cause some erosion on the teeth there. Tartar is just technically what they call hardened buildup of plaque on the teeth. And then there's also periodontal disease like gingivitis, where there's going to be these very reddened, swollen gums. Bleeding gums, can be receding gum lines, so there's definitely inflammation and damage happening there. And then with advanced periodontal disease, you can even see, losing teeth, or just loose teeth, maybe even abnormal drainage, like pus kind of a drainage coming from the gums whenever they are pressed on. Other pictures here, glossitis. This is just simply inflammation of the tongue. So just some irritation of the tissue there, also kind of a reddened appearance to the tissue as well. Picture of stomatitis, inflammation of the oral mucosa. So again, reddened appearance, very, enlarged, inflamed areas, painful typically. Halitosis is just simply bad breath, and there's lots of different things that, different reasons that can cause these issues, bacteria, viruses, any kind of mechanical trauma to the mucosa could cause the stomatitis, any kind of irritants to the mucosa, maybe even nutritional deficiencies are causing inflammation of the mucosa. The halitosis could even be just due to like a secondary infection like a sinus infection, periodontal disease, tonsil stones, things like that. Picture here of chylosis. It's inflammation of the lips. As you can see, kind of the edges, the creases there of the lips become very reddened and inflamed at the angles of the mouth. This is a common condition you will see here, candidiasis, also known as Candida albicans or thrush. They all mean the same thing. And this is just a fungal growth or a fungal infection on the oral mucosa. And the symptoms, what you're going to see with this, are these white patches that are present on like the tongue, the lining of the cheeks, the buccal mucosa, the palate, any of those areas. It can extend down into the throat. If those little white patches get scraped off, it could cause some bleeding at that site. Usually patients that we see this kind of a fungal growth happen in are those people who have a decreased immunity or decreased immune system. So think about maybe patients with cancer who are on chemotherapy. Also, like chewing tobacco is a risk too as well. So any kind of reason that any kind of a condition that could cause a decrease in immunity could cause this type of a infection to develop. Those patients that we would consider at risk for oral problems, any patient who is seriously ill, confused because they might not know to keep up with oral hygiene or have the cognitive ability to know how to do that. Comatose patients, and that's again because they're not able to do the care themselves, so without a care provider such as a nurse doing that for them, they're going to be having bacteria and all of those cells building up in the mouth, not being cleaned, and then that's going to increase the risk of infection and dental problems there. Patients who are depressed and just have that decreased desire or energy level to perform hygiene, dehydrated because the mucous membranes get dried out. NG tubes can cause irritation to the mucosa. Nasogastric tube is what that stands for. And then oxygen therapy is very drying to the mucous membranes. So when that oxygen is blowing into the nasal mucosa, for example, it's very drying and irritating, so that could cause some trauma there. And then any kind of, open wounds or incisions in the mouth or jaw surgery, things like that, puts it at risk as well. Patients who have inadequate nutrition. We need all of those nutrients in order to maintain healthy tissues in the body, so when we're lacking those, increases the risk there. Sugar intake, just because bacteria really like sugar, so bacterial growth will increase where there's high sugar levels. And if family history, there's just some people just have a higher tendency to develop things like cavities, that periodontal disease, things like that. So there's just that kind of a genetic tendency as well. Elderly patients, just decreased energy levels to perform hygiene care, or possibly confused patients within that elderly patient population. Decreased saliva, drying out the mucous membranes. If they're a very heavy smoker, that's very irritating and damaging to the tissues as well. Different medications. Diuretics, again, can be drying to tissues if we're losing excessive amounts of fluids. Chemotherapeutic agents, as we mentioned earlier, increases that risk for thrush. Anticoagulants, just increasing the risk for bleeding in the mucosa. So how do we promote oral health and oral hygiene? We want to teach our patients about brushing teeth at least twice a day, morning and night before bed, and maybe even more if they are one of those patients and one of those people that just have a higher risk of dental disease, periodontal disease. They may need to brush more frequently than that. Using a small soft toothbrush and flossing daily included in that is important, and they also recommend a fluoride mouthwash as well once a day can be beneficial. Routine dental care by a dentist. This should be every 6 months is what's recommended, so twice a year visiting the dentist, getting that preventative care and checking for any signs of decay. And getting attention to any abnormals or any problems and treating those promptly before they progress. Good nutrition. Dentures, for those patients who do use dentures, are they taking care of them properly, cleaning them properly? Do they still fit properly in the patient's mouth? That's something, that can change over time if gum lines change, things like that. So assessing that as well. So the next assessment would be moving on to the ears. And does the patient have any history of hearing loss, any hearing disorders? Do they use any hearing aids, and do they know how to properly care for those? This picture here shows what we call cerumen, which is earwax. That can obviously become impacted into the ear canal, and then that can definitely impair a patient's hearing and decrease their hearing ability. So assessing for that, any kind of issue with earwax buildup there. Normal ear characteristics, we should see no drainage, no redness, no lesions on the ears. If you do ever notice drainage coming from a patient's ear, then I would suspect that maybe there was a middle ear infection and the eardrum has ruptured, and now that infectious drainage has found its way out and it's draining through the ear canal. So that would be something to notify the physician about. Hearing aids. Plenty of patients you're going to encounter in your nursing career that use hearing aids. Make sure that patients know how to use them properly, using and keeping the batteries charged, if they can turn them off when they're not using them to help save the battery life, replace them as needed. Again, increase in that cerumen or earwax buildup in the ears can definitely decrease their hearing ability. So that's something that if they're noticing there's changes there, they may need to have ears cleaned. And then there's lots of different types of hearing aids that you will encounter. There's behind the ear versions, there are in the canal hearing aids, some newer versions for those that have severe hearing impairment, cochlear implants, and what I would consider to be a little bit an older version would be the body hearing aid. This is just like a rectangular case that's carried on the body. It's connected to cords that are then that are connected to ear molds that are placed into the ear canal. Again, these were used for very severe hearing loss, not used as much anymore. You're going to see more of the hearing aids and cochlear implants. Pictures of the different variations of hearing aids there, the behind the ear, in the canal, the different variations. The 100% invisible type here is really neat as well for those patients that are able to have that type. And then you can see here the body hearing aids, the kind of older versions of hearing aids that you could see used for hearing impairment. Newer versions here with the cochlear implants that are surgically implanted through the skull there. So you will encounter patients with all of those different hearing devices. Moving on to nose care and assessment. Any previous trauma to the nasal mucosa? Have they had any surgeries like on the nasal septum, and any trouble with smelling function? Medications that they use, nasal medications, any sprays, things like that. Abnormal bleeding or secretions. Some people are just at a higher risk for nosebleeds. They just are much more likely or tend to develop those. It could just be a genetic thing, but it also could be maybe due to an underlying disease process like a hemophilia, a coagulation disorder. Maybe they have liver disease. Maybe they use an anticoagulant, a medication, so that's increasing their risk for nosebleeds. So any of those things would be important to know about. Do they have any history of sinus problems, seasonal allergies? Be aware of those. To help promote the nasal mucosa health, humidifiers are very beneficial in the wintertime. The environment's so dry, the air's so dry, so some of those patients who are much more likely to develop nosebleeds could really benefit from that, even saline, nasal sprays, things like that. And then just decreasing any trauma to the nasal mucosa, no excessive force when blowing the nose. Those are good teaching points for patients as well. A special consideration here, NG tubes, which means nasogastric tube. So this is a tube that obviously you can see in the pictures here extends from the nose and goes all the way down, finds its way down into the stomach. And the tape on that, you can kind of see here in the picture, there's going to be some kind of tape securing that, either to the bridge of the nose, or for the child here, you can see it taped to the cheek. But that tape needs to definitely be changed on a daily basis because you don't want to cause any skin breakdown underneath that. So that needs to be changed, cleaned, that skin cleaned daily, and then a new adhesive applied. Assess the skin frequently for any possible breakdown, redness, anything like that. Cotton-tipped applicators can be used to help clean any excess debris or secretions that might be around the tube. Moving on to hair assessment, just finding out what are their normal hair care practices and how can you assist with that. How much can the patient do on their own, and then what can I help them with, so their self-care ability. And then do they have any chronic hair or scalp problems? Things like a patient maybe who's receiving, a cancer patient who's receiving chemotherapy or radiation therapy, if they're experiencing that hair loss, that alopecia. Patients who have hypothyroidism as a chronic disorder tend to have more thin, dry, kind of brittle hair. So those are just things to take note of and be aware of. You can also see patients with dandruff issues, just kind of chronic diffuse scaling and of the skin on the scalp there. A lot of times can have some itching on the scalp accompanying that. Pictures of the alopecia, the hair loss that can be due to complications of treatment therapies. Skin infestations that you can see, lice, also known as pediculosis, and this is infestation of the skin here, and these little mites come in and they cause abrasions on the skin, scratching on the skin, which can also cause some little hemorrhagic spots as well, so causing lots of discomfort. And then another type of itch mite in the skin would be scabies, very contagious as well, just like lice. These will burrow into the skin and find their way into skin folds, in between fingers, in between toes, things like that. Very itchy, uncomfortable in the skin, causing little lesions. Hirsutism is another condition that you can see with hair growth, and in the skin it's just excessive growth of body hair. Could be due to a hormonal problem, like too much testosterone in the body. It also is a side effect of some medications as well. So that's something, if this is a new problem and the patient's been taking a medication that has that as a possible side effect, then that would be something to look into and to be aware of. Moving on to the feet and the nails. So do they have any past history of feet or nail issues? Do they have good feet and nail care practices at home, or are they lacking in those areas and they could really use some extensive care with their feet? Do they have the self-care ability to, it can be very exerting to bend over and to physically wash the feet, trim nails, things like that. So make sure they have that physical ability to do that. Do they have any chronic diseases like diabetes or peripheral vascular disease? You'll also hear that called PVD. Do they have those underlying diseases that can cause decreased blood flow to the extremities? So then that will increase the risk of problems with the feet, decreased healing, and those types of issues. So we need to be very aware of those and realize that those patients are at an increased risk for feet and nail problems. You need to assess the nails and the nail beds, assess the feet for any signs of lesions, swelling, edema, any complaints of discomfort, things to kind of be aware of if they're while ambulating. If you notice that they have a limp maybe to one side or another, or just any issues with their gait, maybe there's some underlying pain that they're not really telling us about, so that would be a sign to look for. Any abnormal fungal growths on the skin or in the nails. Are the feet nice and warm to touch? What's the color of the extremities? Some specific nail care needs related to different age groups. So with infants, we just want to make sure that we keep those nice and trimmed so that they are not scratching themselves, and nice and just straight across and smooth. As they get older, then they can be taught how to trim their own nails once they get school age, and just make sure that they're keeping those trimmed and clean. Signs of nail biting, be aware of that, any issues with that as well. Elderly patients may need to soak their nails before trimming them. Over time, the nails can just become kind of hardened and thicken, making it more difficult to care for those. So may need to seek treatment of a professional such as a podiatrist to find out the best ways to care for their nails. That way they don't cause any injury to the nails. We wouldn't want to have them trimmed too short or cause any trauma to the tissues there, increasing the risk of infection, especially for those patients that we mentioned, like with diabetes or PVD, where they have that decreased healing ability in the extremities. So always keeping nails, toenails, fingernails, all of those trimmed straight across and nice and short. Moving on to perineal assessment. Okay, do they have that self-care ability in order to perform their own peri-care? Again, it's one of those areas of the body that can be sometimes technically difficult to really reach and to make sure that they're cleaning very well, so they may need some assistance with that. Are they having any difficulties with incontinence? That would definitely be something to clue into and be aware of. Is this a postpartum patient who just gave birth? They're going to have, that patient's going to have very specific peri-care needs. Did they have any kind of a rectal or a genital urinary surgery? Then they may have some specific needs in peri-care post-op. And then any underlying diseases. Do they have a current UTI? Do they have a sexually transmitted infection or disease that we are treating them for? So be aware of all of those. When you're doing physical exam on the perineal area, be looking for any lesions, swelling. Excoriation is redness or irritation to the tissues from moisture. That's caused by moisture on the skin. So you'd be looking for any excoriation. If there is any discharge that you note from the perineal area, you would want to document what we call the COCA. So the color of the discharge, if there's any odor of the discharge, what's the consistency of the discharge, and then the amount. So those would all be important things to document in the patient's chart. And then last, with anal assessment, again, looking for any abnormal lesions, hemorrhoids or distended veins, masses, anything of that sort. And we would definitely want to notify the physician if there are any of those abnormals that the patient may need treatment for. All right, and then finishing up here after assessment, in that whole nursing process, once we've assessed the patient and assessed the situation, we can then formulate what we call a nursing diagnosis, and identify what are the biggest issues going on for this patient. So some examples that I'm going to give you here that are nursing diagnoses relating to hygiene care. So maybe a patient has what we call a self-care deficit. They're physically unable to perform their own hygiene care, maybe due to their underlying health condition. Maybe they're a confused patient and they don't have that cognitive ability to do it, whatever the reason is. That is a very appropriate nursing diagnosis for that type of patient. Maybe because of their health condition, maybe they have severe shortness of breath with activity, so activity intolerance would be a good diagnosis relating to that, and that's impairing their ability to perform their hygiene care, so that would be very appropriate. Also, impaired skin integrity for those patients who maybe have a wound, incision, things like that. Risk for infection also applies to that patient, maybe who has wounds on the skin, on the mucosa, or deficient knowledge. Okay, maybe they lack the information or that education that they need, that knowledge, in order to know how to effectively care for maybe their feet and their nails. You know, it's a diabetic patient and they've never really had that good education on why it's important to take good care of their feet and their nails, and so a knowledge deficit or deficient knowledge, either way you want to say that, would be very appropriate for that patient. So once we have formulated our nursing diagnoses, then what we're going to do is we're going to create a plan, and this plan is going to basically give us an optimal plan of action on how to care for this patient so that we can meet the best outcome for that patient. So some examples of what we want to see, I want to see the patient will actively participate in hygiene care or self-care measures at their optimal level of functioning. I want to see that the skin remains intact, it's supple, it's warm, odor-free, okay, no signs of infection. I want to see their oral hygiene is maintained and is nice and healthy, no signs of dental disease or periodontal disease. The patient will not experience any alterations in their skin integrity or any alterations in their feet care, nail care, things like that. So I want to see all of that maintains nice and healthy. And then once I've formulated that plan, I can now implement that and put it into action. So through health promotion, I need to make sure that I'm creating a plan of action that is very personalized to each and every patient. Everybody has different needs and different desires on how they want hygiene care done. And I need to make sure that I'm allowing the patient to do as much as possible for themselves, and then I'm there to assist with the rest of that and kind of bridge that gap for them. Make sure those good rule of thumbs to always remember, you always want to make sure that you rinse the skin very well when you are bathing a patient. We never leave soap on the skin. We discussed in part 1 of the lecture how drying that is to the skin. So we always want to make sure that we get that good and rinsed off. So to finish up part 2 of the lecture here, let's just talk about different times of the day that we perform hygiene activities. So early morning care or early AM care, this is where you go in, you meet your patient, and you can help them get up out of bed, help them get up and ready for breakfast, assist them to the bathroom for elimination needs, or if they have a bedside commode or a bedpan or urinal, whatever their restrictions are at that time, then you'll use whatever device that they need to use. Maybe assist them with washing the hands, face, just to help them kind of wake up. Any oral care at that time before breakfast that they would like to perform. And then other AM care after breakfast, again, offer elimination needs, assist them to the bathroom, to the bedside commode, maybe urinal, bedpan, whatever it is that they're using at the time. And then if the patient prefers that morning bath or shower, then assist them with that and be sure that we're getting a full bath in with peri-care as well. Get them into a fresh change of clothes, any kind of oral care, so that would be a good time brushing the teeth after breakfast. And then any nail care that they might need, if they need them trimmed, or hair care, drying the hair, styling the hair, whatever the patient would prefer on that after their shower or bath. And then just make sure when you're finished with all of that that you maybe get them fresh linens on their bed, get them a nice clean set of sheets on the bed, straighten up the room. Again, we never leave any dirty towels, wet towels, dirty linens, bed linens, anything like that on the floor. All of that goes straight into the linen cart. And then some afternoon care options. Maybe the patient had some diagnostic testing that morning or some kind of a therapy that they went to, so whatever care they might need after that, again, offer assistance with elimination needs. Maybe they want to kind of wash face and hands just to kind of clean up for the afternoon. Again, if there's any additional oral care that the patient would like assistance with, offer your help with that as well. And then HS care means at bedtime care. So HS, abbreviation for at bedtime. So again, offer help with elimination, wash face and hands prior to bed, oral care, definitely need to brush teeth, floss, use a fluoride mouthwash if they have that with them. And then back massage is always something that I think is really nice to offer patients. It's just a nice way for them to relax prior to bedtime, can help just decrease any maybe anxiety that they're having about their health and just help them to be able to sleep better that night. So that's always nice to offer, especially if that patient prefers the evening time bath or shower. You could offer that after they have been cleaned up and then apply the lotion to the skin right after the bath. And then PRN care is just as needed care. PRN stands for as needed, so any time of the day, whenever necessary, we offer assistance with hygiene care. So this will end part 2 of the hygiene lecture, and we'll finish up next with part 3.